So yes, thank you very much again for the opportunity to talk about this important topic. And I believe it is indeed important, not only because it's important how a doctor makes the patient, but you will hear from my talk, it's important about how we relate to each other. And I know that theme has come up a lot, but I hope to sort of illustrate that again. So when I was asked or invited by Father George to give this talk, I went home and I said, I've been giving this talk, it sounds exciting. My wife said, oh, that's a really good topic, bedside manner. My children looked at me and said, bedside manner, what's that? We've never heard of that before. Which makes me think that maybe it's an old-fashioned concept. So I've chosen an image, which is an old image. This is a painting, and I'm not sure how you can, if you can see this or not, but it's an image from 1891. It's a very old British painting, and it depicts a doctor at the bedside with a patient. So you've got a young child that's sick, and the doctor looking at the child, trying to work out what's going on, I assume, and the father, which you probably can't see, is just in the background. If we just look at the image of the doctor a bit more closely, we see a number of themes that sort of exemplify the bedside manner. So we see in his face concern, we see empathy, we see care, compassion, professionalism, we see a focus, an intense focus. A patient centeredness. The patient in the previous image was right in the center of the image. He looks connected with the patient, he looks wise, and he looks responsible. So that image really illustrates what the bedside manner is all about. But it's an old image. So look at the modern doctor and we think about what we would like to see when we go and see a doctor. We want to see someone well presented. Yes, we want to see that they are respectable. They may not all have a white coat, but we want them to look clean at least. We often have a name badge that identifies the doctor. We want them to be non-judgmental. We want them to be respectful and to be active listeners. So why the bedside? Well, the bedside because the patient is sick, the patient is vulnerable. They're often in bed in a hospital and unable to get up in many cases. And yet the doctor is standing. The doctor's healthy. The doctor's usually on the right side. So as medical students, we were told, always approach the patient from the right side. Why? Because the left side in Latin is sinistra, which sounds like sinister. So you should always go on the right side. And we're in a position of authority. So being in authority, there's a power differential between the doctor and the patient. So we need to have ethical care and we need to have mutual respect. Just as the patient respects us, we need to respect the patient as well. And we all know that a good first impression of a doctor inspires faith in the doctor and establishes what we call the therapeutic relationship. A good therapeutic relationship means that the patient trusts the doctor and gives them the information that they require in order to treat them optimally. The patient is also more likely to comply with the doctor's orders, if we use another old-fashioned term, doctor's orders. And why do we need manners anyway? Well, good manners, what are they there for? They're there to impress people. When we see someone with their best manners on, to impress the other person and to show them respect. And we like to be polite, courteous, we listen to the patient, we empathise, we are compassionate, and we take time to explain things to the patient. And we hear patients say, oh, the doctor is lovely. They made me feel so much better. The doctor may not help their disease or cure them, but they made them feel better. So manners can make patients feel better emotionally, and pain can be eased just by the hope that's given by the doctor. I want to talk about two more technical concepts, and they are the concept of transference and countertransference. Now, Sigmund Freud, many of you have heard of, he was the Viennese neurologist, actually, that is called the father of psychoanalysis or psychiatry. And in 1912, he described these concepts or these dynamics of transference and countertransference. And he described transference as a phenomenon whereby the relationship that a patient has with their doctor is influenced by past relationships that the patient has had with significant role models, such as their parents. Okay, they've had a bad relationship with parents, they have a similar sort of transference, they transfer that on to the doctor. And countertransference refers to how the doctor's subconscious leads to change them in the way that they relate to the patient, based on their own experiences of having interacted with people that the patient reminds them of. So transference, what the patient transfers to the doctor, countertransference, what the doctor transfers back onto the patient. Okay? And Dr. John Brakoulias talked about how the patient, it can make us angry sometimes. We have to be mindful of this because there could be either transference or countertransference or both. So these reactions as well are really subconscious. They happen without us being aware of it, and they happen very quickly, in milliseconds. So we need to be aware of this phenomenon, and we need to make sure that it doesn't disadvantage or harm the patient. For example, when we become angry with the patient, it could lead to harming that patient. And if we feel angry with the patient, we need to be aware and realise that other doctors have probably felt the same with this patient. And we need to recognise that we're feeling like this. We need to label it if we're able to, and try to say, look, I apologise if you're getting distressed, and just focus on the problem and try to help the patient where you can. So the concepts of transference, countertransference. The other concept I want to talk about was the placebo response, which you probably have heard about. So placebo, for those that don't know, a placebo pill is the sugar pill. It's the treatment that's not supposed to cause an outcome. So we have trials and we say, okay, we don't know what we're giving the patient. Some patients will give them the active ingredient, some people will give the placebo or the sugar pill, okay, which is not supposed to have a reaction. So we can compare, does the active treatment or the treatment they're trying to investigate or research, is it effective compared to something that's nothing, like a sugar pill, or not? So that's the placebo. Now what we see though is that placebo also has a response. Even the fake pill or the sugar pill can have a response with the patient. And in fact, that response is increasing over the years. And so we think, why is it increasing? Because we think, we're not sure, but we think it's because the studies are getting longer. The investigator or the researcher is getting more of a rapport with the patient. They have to explain things, they have to be respectful of the patient, they have to ask for their signature to do the study. They are doing all sorts of assessments. And so there is some sort of doctor-patient relationship there that's forming, even with the placebo medication. So we think that the placebo response is determined by the rapport that the patient has developed and also the faith that the patient has developed in the doctor. So it's possible that good bedside manners also enhance the expectations and the placebo response. Now, of course, bedside manners have broader implications and applications. And you've heard Greg say that I'm the president of a local community in Blacktown, where bedside manners are important as well. It's not just for doctors. So the concept of transference, countertransference, we deal with every day. The placebo effects, expectations, affect everyone in all settings. So parishioners, they come to our church and they're in need of spiritual assistance. They come to the Pagari sometimes and they're angry. They're angry because they didn't get parking, or they're angry because of the price of Koliva, or something. It's not necessarily that they're angry with us. And we need to be aware of that. And I always tell my community members, just be aware, we're in a position of authority here, And the patient may be angry for a variety of different reasons, but we always need to maintain the respect for the individual in front of us. And we've talked about the Bible reading today, about Jesus and how he had compassion on the multitude of people. And our parish priest this morning, Father Alexi, said a similar thing to everyone. He said, sometimes it's not about fixing the problem. It's about listening respectfully to the person in front of you. And just listening to the person can lead to such an improvement and enhance that relationship you have with someone and make them feel so much better. Several months ago, someone was upset with me about some flyer that was produced, and why? You should be taking it down. You're the president. You should be more responsible. You should not be, putting these things out. And okay, I listened to him. I said, look, I think you have got a point there. We discussed it, and since then he has had a different level of respect for me. He comes, how are you, etc. Things, obviously I showed him respect, he reciprocated and also showed me respect. So working in the church of parishioners, it's very important to have the same degree of manners, to impress them, to like we said, improve the relationship with them and improve outcomes for them. And in fact, it helps me to remind myself that everyone is made in the image of God. And so we have to respect them regardless of how they present to us. So we call it Bedside manners rather than bedside manners. In summary, I believe every human being demands respect. Not only do they just require it or should be given respect, but I think they demand respect, just like we demand respect, just like we demand kirileison, so that we can be shown mercy. We need to be mindful of our positions of authority. We also need to work ethically, connect with people that are sent to us so that we can help them. The experience of learning bedside manners, and it is an experience, it's not something you can just read in a textbook. You need to do it again and again to understand what bedside manners are, can assist us in gaining rapport with others, enhancing their expectations, and delivering better outcomes regardless of the setting. So thank you very much again.